Hey everyone, in this video I'm going to be talking about the antidepressant Trazodone. For some background, in 1981 Trazodone was approved by the FDA for the treatment of major depressive disorder. Trazodone is now generic, but previous brand names it was known by include Desyrel, which was the immediate release formulation, and Oleptro, which was the extended release formulation. In terms of its class, Trazodone is a serotonin antagonist and reuptake inhibitor. Additionally, it's known as an atypical antidepressant, along with medications like mirtazapine. Moving on to pharmacokinetics, trazodone is primarily metabolized by the liver. It reaches peak plasma time within an hour if taken on an empty stomach and within 2.5 hours if taken with food. Its half-life is somewhere between 5 to 9 hours, and it's metabolized by the CYP450 system, primarily through 3A4. To me, this is one of the most interesting things about trazodone because you'll know that at different doses, trazodone can act differently. So if we're talking low doses, which are generally below 150 milligrams, trazodone will have mostly sedative effects. So you'll see it acts as an H1 antagonist, leading to some sedation. It'll act as an alpha-1 antagonist, which can lower the blood pressure, and you always want to be mindful of orthostatic hypotension. And then you'll also get antagonism at the 5-HT2A receptors, so that'll lead to mostly sedation and maybe some very mild antidepressant and anxiolytic effects. But it's really when we get above 150 and up to 600 that we start to see trazodone act as an antidepressant. So this comes by way of SER antagonism, so this will lead to increased serotonin, which obviously has a nice antidepressant effect. 5-HT2C antagonism will increase serotonin and norepinephrine, and 5-HT2A antagonism will cause further antidepressant anxiolytic effects. Obviously, we refer to trazodone as an antidepressant, but it's really once you get over 150 that you start to see these antidepressant effects. In terms of indications, the only FDA-approved indication is major depressive disorder. However, there are a number of off-label uses. Primarily, this is insomnia, so you'll remember that at low doses, trazodone will have mostly sedative effects, so this is where you'll see a lot of use of trazodone in the hospital. Additionally, we can see anxiety disorders, bulimia, fibromyalgia, agitation in patients with dementia, and then also in patients who have had SSRI-induced sexual dysfunction, because you'll remember that trazodone has 5-HT2A antagonism, so this will help counteract some of those dysfunctions that may have been caused by the SSRIs. Moving on to dosing and formulation, so trazodone is available as an oral tablet and it comes in doses of 50, 100, 150, and 300. In terms of dosing for major depressive disorder, you could start off at 150 milligrams and divided dose, so this could be 53 times per day, for instance, and then you want to increase it by 50 milligrams every 3 to 4 days for a max dose of 600 daily. For patients getting trazodone for insomnia, you could go anywhere from 25 to 150 milligrams nightly. Contraindications for trazodone use include monoamine oxidase inhibitor use, linezolid, or methylene blue, and it's also not recommended in the use of those in the initial recovery phase of a myocardial infarction. Certain drug-drug interactions to be aware of include medications that are CYP3A4 inducers or inhibitors. Remember that trazodone is metabolized by CYP3A4, so medications that induce 3A4 will decrease the levels of trazodone, and 3A4 inhibitors will increase levels of trazodone. Some important adverse reactions or side effects to be aware of for trazodone include priapism, so a sustained erection for more than 4 hours is a medical emergency. It's important that patients seek medical attention for this. Orthostatic hypotension and syncope is another, especially due to the alpha-1 antagonism. You will see sedation, which is, of course, something we use to our benefit for patients in the hospital. It is possible that trazodone is arrhythmogenic in patients who have pre-existing cardiac disease. You also always want to be mindful for serotonin syndrome, although this is rare. And then you can also see some constipation, nausea, xerostomia, and blurred vision. And I just had some last minute thoughts that I wanted to share. So you might be aware that doxepin, brand name Silanor, is the only antidepressant that is FDA approved for insomnia. However, trazodone is actually the most commonly prescribed antidepressant for insomnia. The actual evidence linking trazodone with treating insomnia is actually quite limited, but it's still incredibly commonly used. And if you could see here below, it's actually consistently ranks within the top 25 medications prescribed in the US. Additionally, trazodone is FDA Category C for pregnant patients, and it has also been studied to help treat akathisia in those who have been taking antipsychotics. Thank you so much for watching. If you have any questions, please feel free to leave them below.